Have you ever felt yourself or come across anyone who complains of a false sense of motion in which there is a feeling that the environment is moving despite being stationary? Then it is possible that you or the one complaining about this is suffering from vertigo. It is important to know that vertigo is not a disease. It is a symptom or a sign that there may be a problem with the body's balance system. Vertigo at times is mistaken as a feeling of dizziness or lightheadedness. Although people of all ages can suffer from vertigo, elderly people are more likely to have it. In order to understand what goes wrong during vertigo, it is important for us to know how our body's balance system works. Our body's balance system comprises of the brain, our eyes, our muscles, especially the ones that help us sit, walk and run. And lastly, the inner parts of our ears, also called the inner ear. The brain, by coordinating with the inputs it receives from the eyes, muscles and inner ears, helps maintain our balance during various activities we do during the day. Vertigo is caused because of a problem in the body's balance system. The main cause of vertigo can be explained by a theory called the mismatch concept. According to this concept, there is a mismatch of the inputs received by the brain. This mismatch can be between the different inputs received from the eyes, muscles, or inner ears. Vertigo can also be caused due to a mismatch between inputs received by the brain from the right and the left inner ears. Vertigo is generally experienced as an episode or an attack. In case of a vertigo attack, you will experience the sensation of false motion. During an attack, a person may also experience nausea or feel like vomiting and may have abnormal eye movements, sweating, loss of hearing, or a ringing sensation in the ears. It is important to know what kinds of situations are likely to cause vertigo. Any activity where the person's head moves can trigger an attack. For example, rolling in bed, looking upward, bending forward, going up or down stairs, or moving around in a dark room. Also, a viral infection of the respiratory tract. Head injury, exposure to loud noises, stress, and anxiety can cause a vertigo attack. Moreover, vertigo can also be experienced before or after a migraine attack. Many people believe that vertigo and motion sickness is the same thing. It is not so. Vertigo is the feeling that you are moving when you are actually still, whereas motion sickness is the unpleasant feeling when you are actually moving, such as traveling in a vehicle. It is important to take a doctor's help in case of vertigo. The attacks may be mild or severe and may last for as little as a second or even as long as a month. In any case, a doctor must be consulted. However, in cases where vertigo is accompanied with symptoms like double vision, difficulty in speaking, headache, weakness, abnormal eye movements, difficulty in walking or controlling arms and legs, or a different sense of consciousness, the patient must be taken to the doctor immediately. The treatment depends on the cause. Medicines can help relieve vertigo attacks, while certain exercises called rehabilitation exercises can also reduce or get rid of vertigo symptoms. Mostly, a combination of both is used to treat the patient. This is decided by the doctor. Follow the steps to help you manage acute attacks of vertigo. First, immobilize your head. The best place to be is on the floor. Then, without moving your head, you should fix your eyes onto something stable. Do not move until your nausea subsides. Then, first move your eyes. And then your arms and legs. And gradually add more movement until you feel your condition improving. These movements should be attempted without moving your head or changing what you are looking at. In case if you feel like vomiting, do so, and do not eat or drink for at least 1 hour. After an hour, gradually try small sips of water or other fluids if you can tolerate them. Take medications if prescribed earlier to counter the attacks. Following the attack, try to sleep. Remember, precaution is always important to manage health problems. One should go to a doctor after experiencing the first sign of vertigo. If one's balance is affected, they should be careful so as to prevent falling and hurting themselves. After an attack, even if one feels fine, they should avoid activities that will cause another attack. One should also ensure that they do not drive after an attack and usually rest for a day. Any home therapy should only be undertaken if you have already been diagnosed with vertigo and after consulting a doctor. Stress must be avoided as much as possible, and medicines must be taken as prescribed by the doctor. One must do the rehabilitation exercises that the doctor has prescribed. Last but not least, one must always follow the doctor's advice.